Mansfield today on a Wednesday, and that means it's time to look at medical matters with our resident GP, Dr. Vicky Skitter, who is you're still looking like you're in holiday mode.
I am. I'm trying to be, but now it's time to go back. Yeah, I've been holiday after holiday, hey?
Yeah.
It's been awesome.
Yeah,
Well, it's been disrupting as well.
yeah, but also I haven't known what day it is.
I know.
You know,
It is confusing.
it's totally confusing.
Yeah, the kids go back to school today, and I have to focus, pull myself
Yeah,
towards myself.
So you haven't got any more excuses.
No, I
Yeah.
have to be on top of my game. It's going to be hard.
Yeah. Focus.
Focus. Okay.
Speaking of focus, we're talking today about ADHD. Dr. Vicky, what is it?
ADHD is attention deficit and hyperactivity disorder. So they say about 7 to 8% of children have it, and about 3 to 4% of adults. It usually starts in childhood and it sort of goes through into adulthood. But the hyperactive part of it, the child doesn't need to be all over the show, hyperactive, and to have ADHD. The H stands for the hyperactivity. So the impulsivity and the hyperactivity can be there or not. Often in girls, it's not so obvious. They say often the quiet, dreamy type of child. It gets missed in them. Sometimes it gets diagnosed a bit later. But the core feature of ADHD is attention deficit. So it's difficulty in concentrating and focusing on tasks. It's people that get forgetful about completing tasks. They're easily distracted, difficult to sit still. They interrupt people while talking. What happens then is they make frequent mistakes. They might miss details when they're studying or working. It's hard for them to maintain focus when listening or reading or holding conversation. Trouble organizing daily tasks. They lose items frequently. Easily distracted by small things happening around them. But sometimes you have a naughty child. So it's difficult to have you've got a naughty attention-seeking child at school, and now the teachers will say, well, this child's definitely got ADHD. But you have to look what they like at home, or other way around. They might be awful at home and perfect at school,
Yeah.
and then the diagnosis is less likely. It has to sort of be a consistent thing.
How do you decide if someone actually needs medication?
Yeah. It's slightly complicated because you need to basically figure out, is this person functioning optimally? It's hard in the sense where you get a clever adult, he's a CEO of a company, surely you can't have ADHD, but the fact is, for that person, it takes a lot more time and effort and energy to achieve this lifestyle or being the CEO. If he was on medication, maybe things will be much easier, less stressful. His functioning will be better. So it is a bit difficult. You've got, like, say, for example, a hyperactive, busy child all over the show, but he's doing well at school. Then you can ask, can I improve this child's functioning? So it's important to engage with the parents, engage with the teachers, see what's going on behind the scenes, what happens at home, what happens when they have to do homework. Are they coping emotionally with the stress of homework and tests and exams and stuff like that? You'll find that intelligent people will often find coping mechanisms to compensate for their attention deficit. They might do well at school as a child, but then later in life, when the pressure becomes a bit too much, they fall apart a bit. So it's all about functioning optimally.
Are there other medical conditions to consider along with ADHD symptoms?
Look, one has to obviously examine the person and go into the history at length. You can't just listen for 5 minutes and decide they've got ADHD. But people with thyroid issues, for example, hyperactive thyroid, some medications can cause attention problems. Other psychiatric disorders like depression and anxiety can also mimic that. So if you're then not sure and you treat the patient for their anxiety or depression and their functioning becomes fine and they're coping at work and they're functioning, then obviously they don't have ADHD. You've now treated the anxiety or the depression. So that's the one thing. Substance abuse is also another thing. So medication with, for example, codeine, people that smoke cannabis on a regular basis, alcohol abuse, sleep deprivation is a big one, you can imagine. You can't focus. And excessive screen time or overuse of technology. Now, last night, I was talking to my daughter while she was on a WhatsApp live conversation with a friend, while she was also on WhatsApp talking to 2 other different people. How on earth, man? So they're all over the show.
Yeah.
So the screen time and technology, I don't know.
Yeah, so you've got the big screen TV,
Yeah.
which is showing a movie.
Yeah.
And you've got TikTok happening right
Yes,
here.
exactly.
And they're busy.
Absolutely, playing Xbox or something,
Yeah.
and the iPad is on the side,
Yeah.
and then they still hear when you're saying something ugly about them in the background.
Yeah, but they only hear the ugly stuff.
They hear the good things.
What other treatment, apart from medication, can be helpful?
Okay. It's difficult because medication, specifically in adults, that's the real, the go-to. Adults really just do much better on medication, but there's lifestyle changes that one needs to make. For example, the normal healthy eating, regular exercise, sleeping properly, less alcohol or other drugs or substances. And then there's also cognitive behavior therapy where people will coach and train you to develop skills to compensate for that attention deficit. So it's a multimodal approach. But my opinion, obviously you get homeopathic stuff and there's, and I'm not shooting that down at all. But as just a GP, my opinion, if you've got a real bad case of ADHD, then you put them on medication. That's my opinion.
What kind of medications are available to treat ADHD?
So there's basically 2 classes. You get the stimulants, to keep the brain active, and you get the non-stimulating medication. So the stimulants are those, the Ritalin, Concerta, Strattera, those names that people will probably know. The non-stimulating ones, for example, antidepressants like Wellbutrin and Venlaw, they work on your dopamine and your noradrenaline levels. So that can help, especially if there's comorbid depression and anxiety, present. It's not as effective for the ADHD, but some people can't handle the stimulant. Some kids lose weight, they lose their appetite, they can't eat, or they can't sleep. There are certain people that can't handle that. So there are options at least. People are often scared that when they take the medication, their personality will change or their creativity will sort of disappear. That's not true. That doesn't happen. Patients often have ideas and schemes and plans, but they can't implement them, the ADHD patients. So it's an executive dysfunction. So medication enables you to execute your plans, to make things happen, to put your brain into gear, to make you achieve optimum sort of functioning and have a better quality of life, I think. And there's another thing that patients say, is there a certain age that you should stop using it? So maybe when you retire, for example, you're an adult, you're now the CEO, and now you retire, you still have, even as an elderly person, you still have finances to cope with and relationship issues and, stress that stress older people. Just to go to the shopping center and to make a list to shop or what we need can be a stress. So they can still use it. There's no contraindication in doing that.
Yeah, we were speaking just yesterday to Advocate Brogden
Yeah.
about people moving into smaller homes and what it means, and complexes and retirement villages.
Yeah.
And the different pressure that brings,
Yeah.
moving into a retirement village,
Yeah.
for example.
It's very stressful for them.
Yeah. And he was saying exactly the same thing as you. You know, just be aware that you are in a confined environment now. So if you're an ADHD ex-CEO, you may find it difficult living in this, where you were living in a big house with a big garden and all the rest.
Exactly.
Now you can find.
And the other thing is, like, this CEO, say he's ADHD and he's not on treatment, they often have their good personal assistants that like organize their lives for them, and a good wife that looks after the kids and the house and the finances at home, and suddenly that's now gone. And just remember, this ADHD spills over, not from work, spills over into relationships as well. So it's said that I think the divorce rate in ADHD people untreated, I assume, is like double that of the normal, you know, because they're often bad drivers and they interrupt people and they don't, you know, interact with people properly, and all of these things can happen. But one thing that I want to say quickly, if I may, before you shut me up, is because these medications, it's just something that I've found in my practice, the patients, because it's Schedule 5 and Schedule 6 medications, you can't give a repeat script. So you can't give a repeat times 6 and the patient only needs to see you in 6 months' time. You need a new original script every month, written out properly and all of that. And often when you've seen the pediatrician or the psychiatrist or the neurologist that put you on the medication, which I think is the right thing, you should see a person that specializes in this, to start you off in the right way. If you've got your script from them to now get a script from the specialist every month, a new one, is almost impossible and very expensive. So I always give my patients, say, 3 original scripts, you know, with different dates on. Once I know they're stable on treatment and they're happy with treatment. So just keep that in mind, that you know, the scripts can be a problem, and your GP can, you know, renew your script for you for cheaper, if she's kind.
Yes, now go back to work.
Okay.
And
Back to work I go.
And don't look so glum about it.
Okay, I'm happy.
Dr. Vicky Skitter, our resident GP, thank you very much for joining us on Mansfield Today.